If you've ever had back or neck pain, you know the deal. You're desperate for some relief, but you're just surrounded by this dizzying number of options. So, what actually works? Today, we're going to cut through all that noise and see what the best scientific evidence really has to say.
So before we even get into solutions, let's just take a second to realize how common this really is. If you're dealing with back pain, trust me, you are part of a massive global club. You are definitely not alone in this.
I mean, whether it's that dull throb you get after a long day at your desk, or a sharp twinge that just stops you in your tracks, this is an almost universal human experience. Honestly, it's a problem that connects pretty much all of us at some point.
And this isn't just about feeling uncomfortable. The scale of this problem is, well, it's staggering. Low back pain is the single biggest cause of disability in the entire world. It impacts whole economies with lost work days and puts this enormous strain on our healthcare systems.
All right, so when that pain hits, what do we do? Where do people even go for help? Let's take a look at a few of the most common treatments on the menu. Okay, first up, you've got spinal manipulative therapy, SMT for short. This is the kind of hands-on treatment you'd probably get from a chiropractor, a manual therapist, or an osteopath. It involves those specific adjustments and movements of the spine.
And then, of course, there's exercise therapy. This one's a huge one, right? It's a cornerstone of physical therapy. The idea here is to go beyond just resting and to actually use specific, structured movements to get you stronger, more flexible, and just, well, functioning better.
Now, you might have also come across something called therapeutic ultrasound. This is where they use sound waves to send heat and energy deep into your tissues. The whole goal is to knock down the pain and hopefully help you recover faster.
And finally, we've got acupuncture. I'm sure you've heard of it. It's an ancient practice that's become a really popular go-to for all sorts of conditions, especially chronic pain.
Okay, so we've got all these different options on the table, but how do we actually know if any of them really work? To get a straight answer, we have to look at the absolute highest standard of evidence we've got.
And for that, we're going to turn to something called a Cochrane Review. Now, these aren't just any old studies. Nope. These are massive, systematic reviews that pull together all the best research on a single topic. Seriously, think of it like the ultimate scientific summary. That's why they're known as the absolute gold standard when it comes to health info you can trust.
All right, let's get into the good stuff. What did these super rigorous reviews actually find when they put these common treatments under the microscope? Well, some of the answers, they might just surprise you.
So first up, spinal manipulative therapy for that long-term chronic low back pain. When they compared it to a sham, basically a fake treatment, there was a small improvement in pain. We're talking about maybe 7 points on a 100-point scale. Now, compared to doing nothing at all, the improvement was a bit better, around 14 points.
But, and this is a huge but, here's the catch. The researchers basically said the evidence for this is low to very low certainty. What does that mean? It means they're not very confident in those numbers. And why not? Because all the studies they looked at were kind of a mess. Different settings, different patients, different SMT techniques. It just makes it impossible to draw a really solid conclusion.
Okay, what about therapeutic ultrasound? Well, when they put it up against a placebo, a fake machine that did nothing, the results were pretty stark. There was little to no difference in pain. Zilch. They saw a tiny, tiny bump in function, but the researchers themselves said it wasn't clinically important. In other words, it's not a change you'd actually feel or notice in your daily life.
And that leads to a pretty blunt conclusion right from the Cochrane Review itself. And I'm quoting here, "The current evidence does not support the use of therapeutic ultrasound in the management of chronic LBP." Can't get much clearer than that.
Okay, now this is where things get really interesting. Let's talk about exercise, because it seems like the results are totally different depending on the situation. For acute low back pain, that sudden new pain, exercise by itself didn't seem to have a meaningful effect. But for neck pain, totally different story. When they combined manual therapy with exercise, they saw a large drop in pain and a decent improvement in function. See, it's complicated.
And you guessed it, here's that theme we keep seeing again and again. Even with that finding for low back pain, the researchers put up a big red flag, saying the evidence is very uncertain. This just hammers home how incredibly tough it is to get a simple, straight answer in this field.
Now, acupuncture, this is where the results get really fascinating. So get this, when they compared it to a sham or placebo acupuncture, the pain relief wasn't really meaningful. And you'd think, okay, case closed, right? But wait, when they compared it to doing nothing at all, acupuncture did provide a clinically important, noticeable level of pain relief and better function. So what's going on there? It raises some super interesting questions.
And there it is again, the warning bell. The quality of the evidence, it got downgraded to moderate to very low certainty. Why? For all the usual suspects we've been talking about. A high risk of bias in the studies, the results were all over the place, and the studies were just too small, which makes everything really imprecise.
Okay, so by now, you're definitely noticing a pattern. You're probably thinking, why is all of this evidence so messy and uncertain? And that is an excellent, excellent question.
And this slide right here really lays it all out. The truth is, studying these kinds of physical treatments is just really, really hard. I mean, think about it. How do you blind someone in a study? You know if someone is touching you or not. Plus, you have all these different studies using different techniques for different amounts of time on all sorts of different people. Of course, the results are going to be a bit messy and inconsistent.
So, okay, given all this uncertainty, what in the world are you supposed to do when your back is absolutely killing you? Where does this leave you when you're just trying to make a smart choice?
All right, let's bring it all home. Here's the takeaway. The science right now isn't pointing to a single miracle cure. There's no magic bullet. But that does not mean these treatments are worthless. For someone in real pain, even a small improvement can feel like a huge win. So the best choice for you probably comes down to personal factors. You got to weigh the potential benefits against the cost, any risks, and just what you feel comfortable with. And what does all this point to? The absolute importance of having an open, informed talk with a healthcare provider that you really trust.
And that really leaves us with one final, big question to think about. When the hard science isn't giving us a clear black and white answer, what becomes the most important factor in your personal journey to feeling better? It's something to really consider as you figure out what's best for you.